Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department. Let's talk about this pandemic. Time once again for the weekly update. Now, the summary is that cases in most places are trending down, and that's great news. But truthfully, we are not yet near where we need to be to truly get out from under the shadow of this virus. Vaccinations are helping, and yes, the rate of people getting vaccinated is down, but people are still getting vaccinated. So if you've chosen to get vaccinated, talk to those you care about who have not. Let them know your experience. Tell them what this has meant to you and those around you. Help answer their questions and concerns. And the series, Why Even Consider Vaccination, in these videos is a good place to go. So now, on to the numbers. Around the country, there are now only 3 states in the red. And note especially Michigan, the Northeast, and Florida, with much more of those places no longer in the red. And 12 states now in the yellow, up from 7 last week. And note all the green in the middle of the country. Frankly, that's where the rest of us need to be. All of our neighbor states continue their downward trends this week, and Tennessee with significant decreases over the past 2 weeks, from nearly being in the red to now nearly being in the yellow. They even have a county in the green. North Carolina, cases, hospitalizations, and deaths now all decreasing. 2 weeks ago, 14 counties in the red, last week 8, this week 5. 2 of which remain in western North Carolina. We'll get to that in just a second. 2 weeks ago, there were 14 in the yellow. Last week, up to 21. This week, up to 28 out of the 100 counties. These, again, all positive trends. In western North Carolina, Cherokee County down, but still in the red. And Macon County, after a couple of weeks of seeing decreasing cases, saw a significant increase this past week and remained well into the red. And look at Buncombe, now down in the yellow, joining Swain, Graham, and Jackson. Clay moving up into the orange, but based on a small absolute change in their numbers. As far as testing, North Carolina up around 6.5 during the week, but ends the week at 4.4. And along with all the western North Carolina counties who are reporting, they all continue below 5%. It should be noted that Cherokee was reported about 9% earlier in the week, but there was no data reported at the week's end. As of Friday, Haywood County has seen 4,352 residents test positive, and you can see we are tracking a little bit below the predicted curve. That's an increase of 49 over last week. 2 weeks ago, you may recall, we saw an increase of 48, and last week it bumped up to 70, which raised concern that we might be heading back towards the red. But despite these ups and downs, overall it looks like we've hit a plateau. Deaths now at 99, we added 1 this past week. And Haywood Regional with around 3 to 5 COVID-related admissions this week, with some of those people in the ICU and on ventilators. So what does this all tell us? Well, if you look at the curve of daily new cases in the United States, you can see it's headed downward, and that's great. But it's just a little less than 50,000 new cases a day, and that puts us just below the peak of last summer's surge. Certainly encouraging, better than when these were going up, but honestly, not yet down to the baseline that we need. Same true for North Carolina. But if you look at Haywood County, the curve of daily new cases looks flat. Recall, our aim is 2 to 3 new cases a day, less than 20 per week. We have been seeing more around 7 to 9 per day, and around 45 to 70 per week. In relaxing public health measures, the governor is reacting to statewide trends, not necessarily what is specifically happening here in western North Carolina or Haywood County. On a policy level, that's great, but it means nothing if each and every one of us does not continue to pay attention. Especially if you are not vaccinated, this is no time to let it all go loose. 50% of the county has vaccinated, and that's great. We need to be closer to 80% before your risk, the risk of those of you not vaccinated, goes down. So if you're on the fence about vaccination, get the straight facts, do your own research, but get all the facts in doing that. Verify what you hear from others and read elsewhere. Make your own decision. And look for the series in these videos, Why Even Consider Vaccination, Part 4 coming up this week. So be well and be careful, especially right now.